We are now going to talk about trauma-informed care recommendations and tools in mental health and behavioral health settings. Mental health can be defined as an individual's state of well-being which can affect how they think, feel, or act. This helps determine how a person handles stress, relates to others, and makes choices. PAs have the flexibility and versatility to work in several mental health and behavioral health settings. These settings include, but are not limited to, behavioral health facilities, psychiatric hospital units, private practices, psychiatric emergency departments, county and state mental health facilities, and prisons or jails. A PA has several roles in a mental health care setting. Some of these roles include providing mental health services under the supervision of a psychiatrist, assessing patients through informal conversations and physical exams, making diagnoses, ordering labs, making referrals, and prescribing medications, as well as performing frequent follow-ups to ensure patients are receiving adequate care and support. Millions of people in the United States are affected by mental health each year. Understanding the physical, social, and financial impact of mental health conditions can help raise public awareness and help advocate for better health care. In the United States, 1 in 5 adults and 1 in 6 adolescents experience mental health per year. 1 in 15 adults experience substance use disorder and mental illness per year. Suicide is the second leading cause of death in those aged 10 to 35 years old. This slide shows the annual prevalence by condition in adults in the United States. The most common condition is anxiety disorder, affecting 19.1% or about 48 million people. In a healthcare setting, patients and providers can experience different factors that create a difficult and unsuccessful health encounter. Providers may experience patients with a wide variety of comorbidities or difficult patient encounters, whereas patients may experience poor health literacy, health anxiety, or previous negative health experiences within the healthcare system. Being aware of factors that contribute to difficult clinical encounters and being prepared to address those issues can help prevent them and make a better experience for both the patient and the provider. We will now talk about some de-escalation techniques among patients who suffer from various mental or behavioral health conditions in order to help reduce the level of conflict in crisis situations. Escalations can be defined as an increase in hostility, tension, or competitive behavior that can be caused by things such as fear, peer pressure, pride, substance use, or anger in instances when a person's needs are unmet. This slide lists several signs of dangerous escalations in an agitated patient, some which include a pale or flushed face, rapid and deep breathing, clenched fists, or pacing movement towards or away from you. The goal of de-escalation is to build a rapid rapport and sense of connectedness with an agitated person in order to reduce the likelihood of escalations to physical violence. It is important to remain calm, utilize appropriate de-escalation techniques, be aware of your surroundings or potential weapons, and position yourself for safety. The safety zone is considered outside of a person's reach. The zone of influence is within the zone of safety but close enough to communicate effectively, and the danger zone is within one's arm's length. Most importantly, it's important to ask for help when needed because your safety is priority. When encountering an escalating patient, remind yourself to remain calm and confident. Be at the same eye level as the patient, reduce noise, distractions, and stimulating sources, and most importantly, listen. Allow the patient to speak without interruptions. Stay engaged and restate the message to show the patient you're trying to understand. In order to verbally de-escalate another person, it's important to open as many clear lines as possible, listen to each other, and have no barriers. Only respond to informational seeking questions, be honest with your patients, maintain respect and dignity for all parties, and be mindful of your tone and voice. Give choices when possible, such as asking, "Would you like to continue our meeting calmly, or would you prefer to stop now and come back tomorrow when things can be more relaxed?"
Utilizing these nonverbal and verbal techniques can help avoid the use of unnecessary chemical and physical restraints.
In escalating situations, you should not do anything to further provoke an agitated patient. Do not be defensive even if comments are directed towards you. Do not defend yourself or anyone else from insults or misconceptions. Do not argue back. Avoid speaking over the patient, and do not answer abusive questions. We are now going to talk about how to effectively interview and perform a physical exam on a patient with a mental or behavioral health disorder. The extent to which a patient is willing to share about a traumatic event can vary. You should remain neutral and unbiased when interviewing these patients. It is important to actively listen and validate their feelings. For example, you could say something like, "It sounds like you're having a lot of feelings about this. That makes sense to me." Additionally, during the interview, be sure to treat the patient like a person rather than a victim by expressing genuine concern and saying something like, "How are you coping with all of this?" Most importantly, foster resilience and enforce strength. This can help promote long-term recovery and healing for the patient. Motivational interviewing is a counseling approach centered around behavior change by helping empower a patient to understand their own goals and motivations. Gauging a person's knowledge, understanding their effort to change, and recognizing their strength can help increase their confidence in their ability to change. Additionally, people are more likely to discuss change if they feel respected, so normalizing difficult topics can help make a patient feel more like they're being asked to change rather than being told to change. When it comes to motivational interviewing, using open-ended questions such as, "What brought you here today?" allows patients to share their full stories. Additionally, reflective listening allows providers to build empathy and affirm that they understand their patients' thoughts and feelings, which can encourage the patients to discuss their reasons for change. In a general setting, unless a patient explicitly talks about their trauma, providers may be unaware of the long-lasting effects the trauma may have on their patient. When it comes to the physical exam, you want to maximize comfort and trust for all patients. The goal is for the patient to feel like they're in control throughout the exam. Be sure to always ask for permission and explain every step of the exam as you go. Next, we're going to talk about trauma-informed care across common mental and behavioral health conditions. We will start by talking about anxiety. The American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes such as increased blood pressure, sweating, dizziness, or rapid heartbeat. Generalized anxiety disorder affects nearly 6.8 million, or 3.1% of adults in the United States. As a provider, knowing how to calm patients down who are experiencing anxiety can make appointment times more productive and pleasant for everyone involved. Before beginning the appointment, make sure that each patient fully understands the whole process of the encounter. Truly listen, stay calm, and address concerns head-on. At the end of the appointment, give the patient a written copy of the treatment plan so they can refer back to it as needed. Screening tools are an important part of preventative care. They can help identify patients at risk of various illnesses early enough to provide adequate treatment, avoid consequences, and improve health outcomes. This slide defines several tools that can be used to screen patients for anxiety. One of the more commonly used tools is the Generalized Anxiety Disorder, or GAD-7. Now we're going to talk about depression. Depression, or major depressive disorder, is defined by the American Psychological Association as a common and serious medical condition that negatively affects how you feel, the way you think, and how you act. More than 21 million, or 8.4% of people in the United States are affected by depression. Persistent depressive disorder is a continuous long-term form of depression that lasts greater than 2 years. This affects over 3 million, or 1.5% of adults in the United States. Effective communication is key to successful treatment and improved outcomes in patients with depression. Explaining the diagnosis can help patients understand the underlying process of their illness.
Explaining the treatment plan can help the patients know what to expect during the course of the treatment, as well as understand the benefits, risks, and side effects of their selective management. This slide lists the components of several tools used to help screen patients with depression. Commonly, general practitioners will screen all patients with the Patient Health Questionnaire or PHQ-2 tool, then further assess patients with other tools as needed. We are now going to talk about suicide. The United States Department of Health and Human Services defines suicide as death caused by self-directed, injurious behavior with the intent to die as a result of the behavior. A suicide attempt is a non-fatal, self-directed, potentially injurious behavior with intent to die as a result of the behavior. A suicide attempt might not result in injury. Suicidal ideation refers to thinking about, considering, or planning a suicide. According to the CDC, in the United States in 2020, suicide was the 12th leading cause of death overall, claiming nearly 46,000 lives. That's equal to about one death every 11 minutes. Early identification and treatment of patients at increased risk for suicide is key to suicide prevention, yet high-risk patients are not always recognized by healthcare providers. When interviewing a patient, it's important to identify their risk for suicide by asking about suicidal thoughts or feelings, plans in place, history of suicide attempts, how many times, and whether it was accidental or intentional. You should also assess their safety at home by asking about their access to certain medications as well as weapons or firearms in their home. When caring for someone who may be feeling suicidal, you should never invalidate their feelings, leave them unattended, give them unrealistic hope, or be judgmental. Defining someone by their struggles can have a deep impact on how they internalize what's happening and their ability to recover. Additionally, as a provider, you should not be afraid to ask patients about having suicidal thoughts. Most often, people who are feeling suicidal are afraid to talk about how they feel. Asking direct questions can help the person feel more comfortable in talking about their feelings. This slide lists several screening tools that can help assess a person's risk for suicide. We are now going to talk about post-traumatic stress disorder, or PTSD. PTSD can be defined as any experience that directly threatens your life or someone else's. Common causes of PTSD include combat or military experiences, physical or sexual assault, serious accidents, natural disasters, or learning about the violent or accidental death of a loved one. In the United States, about 6 out of every 100 people will experience PTSD at some point in their life. Interviewing a patient with PTSD, it's important to be trauma-informed, sensitive, and compassionate. Respect boundaries, express empathy, and do not start the interview by talking about the traumatic event. Instead, you should ease into the more difficult topics by establishing a relationship through easier topics or small talk. There are many tools available when interviewing patients with PTSD. The two main interview tools for PTSD are the clinician-administered PTSD scale for DSM-5, which was developed by the U.S. Department of Veterans Affairs to help diagnose PTSD. The other tool is the PTSD symptom scale interview. This slide lists several self-reported screening tools that are available for PTSD. For example, the Mississippi Scale for Combat-Related PTSD is primarily for veterans. There is also a shorter version of this scale for their spouses or partners. The next topic is alcohol and substance use disorders. The Substance Use and Mental Health Administration, or SAMHSA, defines substance use disorder as the recurrent use of alcohol and/or drugs causing clinically significant impairments, including health problems, disability, and failure to meet major responsibilities at work, school, or home. According to SAMHSA, nearly 139 million Americans over the age of 12 drink alcohol. Among the 15 million individuals with alcohol use disorder, less than 8% of those receive treatment. Additionally, in 2020, nearly 37 million Americans over the age of 12 were current illegal drug users, defined by using within the last 30 days. 9.5 million adults over the age of 18 have comorbid substance use and mental health illnesses. When speaking with patients who are intoxicated, be sure to use the de-escalation techniques mentioned earlier in the lecture for angry and combative patients. Remember to speak clearly, ask simple questions, be firm but not threatening, talk slowly and gently, and avoid controversial topics. This slide lists many screening tools that can be used to help determine if a patient has a substance use disorder. For example, CRAFT is a tool designed to help identify substance use disorder among adolescents between the ages of 12 to 21. Another tool is the Alcohol Use Disorder Identification Test, or AUDIT, which helps provide a framework of interventions to help people with unhealthy alcohol use. The next topics we're going to talk about are psychosis and schizophrenia. The U.S. Department of Health and Human Services defines the word psychosis as a condition that affects the mind where there has been some loss of contact with reality. This can include hallucinations, paranoia, delusions, disordered thoughts, or speech. 3 out of every 100 people in the United States will experience psychosis at some time in their life. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which causes significant distress for the individual, their family members, and friends. Less than 1% of the U.S. population is affected by schizophrenia, but people who receive treatment are able to engage in activities, achieve independence, and enjoy personal relationships. This slide includes a quick screening guide that assesses for psychotic symptoms. Answering yes to any of these questions indicates the need for a more detailed assessment. It is also important to get corroborating information from caregivers or others that are close to the patient. When a person is experiencing hallucinations or delusions, you should not pretend to agree with their hallucinations or delusions. Most often, people experience symptoms that are beyond their control, and you should not ridicule the patient or blame them if what they're saying does not make sense. If a person is experiencing paranoia, you should not encourage or inflame the person's paranoia or use body language that could exacerbate the paranoia. Instead, you should tell the person that you do not see any threats, but that you will stay with them if it helps them feel safe. This slide shows several screening tools that can be used to help identify the symptoms and severity of psychosis and schizophrenia. The next few slides include information for both patients and providers to learn more about how to address disparities across the social determinants of health. These are some general resources for patients and providers. And remember, the National Suicide Prevention Lifeline changed in 2022 to a simple 3-digit number, 988, which can be easier for people to remember in times of crisis. This slide has some social needs resources for patients and providers, which can help individuals connect to programs in their community that provide support for things such as housing, emergency shelters, food, transportation, and crisis resources. This slide has more resources for patients and providers, including Feeding America, Supplemental Nutrition Assistance Program, and Special Supplemental Nutrition Program for Women, Infants, and Children, all which help lower-income individuals buy nutritious food. This concludes the Behavioral Health module. If you would like to learn more about trauma-informed care in women's health, emergency medicine, or primary care, please check out our other modules.